Welcome, everyone, to what I hope will be one of the most thought-provoking sessions you'll attend at this conference. Today, we'll be discussing a simpler way to understand, improve, and deliver both patient experiences and staff engagement that's much more effective and sustainable than traditional approaches. And the need for change to traditional approaches has probably never been greater than it is now. As I think we all know, healthcare providers are facing a perfect storm of challenges right now. Staffing levels, patient safety, costs, and overall patient experiences have made the delivery of care much more difficult than ever before, especially in hospital settings. So clearly, things are pretty tough right there right now. But I do have some good news to share. The insights and strategies we'll share today directly address each of these unprecedented challenges and can help your organization to make significant improvement on them, if you're willing to think differently and consider a new approach. To get us started, I'd like to share a story that illustrates some of the principles we'll be discussing. It's the story of Air Force Lieutenant Colonel Jason Denny. At the height of the pandemic, Jason became gravely ill with a COVID infection and was not expected to survive. A priest had administered the last rites to Jason, and he tearfully said goodbye to his wife and 4 children via FaceTime. And then someone unexpected entered his life and helped to change everything. Here's their story in their own words.
Mi nombre es Rosaura Quinteros y soy housekeeper.
I just got home from work and I told my wife, I feel like I got a fever. I just don't feel right. She took my fever, it was about 101. And she took it again, it was 103. It was just a struggle to get any air into my body. My wife basically scooped me up and put me in the car and drove me to the hospital. And I didn't even get to say goodbye to her. And then the doors closed behind me. I almost felt like you're in solitary confinement.
Llego, agarro mi carrito y subo al área que me es asignada. Del primer día que yo entré, lo primero que él me dice es, ay, lo siento porque tengas que venir a limpiar mi cuarto. Entonces, pues yo le dije que no se preocupara, que estábamos ahí para eso, para él.
I just found out my 16-year-old son was positive with COVID. So I was going through a lot of guilt. My concern was, what did I just do to my family?
She was able to see the pain and the anxiety and the fear in Jason's eyes.
All that was going through my head was a negativity.
Él estaba pues asustado y con toda mi alma yo quería ayudarlo.
Just to have somebody talk to you like you're a human being. It's like a coach pumping you up and getting you ready for a game or something like that to motivate you.
Todos los días yo le decía, recuerde que siempre tiene que pensar positivo y ponerse en manos de Dios, para que él se sintiera mejor y tuviera más ganas de pelear contra la enfermedad.
To have someone there, physically there, saying it to you in this isolation room mattered to me. And it was really part of my healing.
They are such different people. So you have Jason, who is a colonel, and then here's Rosie, an immigrant from Guatemala. Wouldn't it be great if the entire world could just act like Rosaura and Jason?
El día que él salió del hospital, me puse muy feliz por él porque gracias a Dios lo había logrado. Cuando hacemos el trabajo y el trato al paciente con amor y compasión, las barreras del idioma pues se desvanecen.
People just don't know how they matter in your life until you make that connection. She saved my life, just like everybody else.
So how did watching that story make you feel? None of us was directly involved in Jason or Rosaura's experience firsthand, but still, just hearing them tell their story moves us all emotionally. Why is that? In addition, why is it that Jason Denny credits a non-clinical frontline staff member with helping to save his life from a deadly COVID infection? What is it that she did that made such a difference beyond all the clinical care he received? And then how do you think all of this made Rosaura and her frontline colleagues feel? What impact did it have on their job engagement, satisfaction, and loyalty? I suspect we are all familiar with this famous quote from Maya Angelou, and how well it reflects what patients and caregivers expect from their healthcare experiences. It certainly reflects Jason Denny's experience with Rosario Quinteros. However, you may not be familiar with why and how we humans come to feel and behave this way. There's a very well-documented science of human perception and behavior that explains all of this. It also explains why we felt what we did when watching Jason and Rosario's story. Unfortunately, it's a science that's not well known or practiced by most healthcare providers. So what is this foundational human science I'm referring to? Well, the answer to that question actually lies deep in our past. In the original game of Survivor, tens of thousands of years ago, primitive humans had to learn to make two kinds of decisions very quickly and very accurately with very little information whenever they encountered another human. First, they had to determine, what are the intentions of this person towards me? Are they a friend or a foe? Are they going to help me or hurt me? Give something to me or take something from me? More simply, what degree of warmth can we detect about their intentions? Then, a split second later, given what we believe their intention to be, what ability do they have to carry out those intentions? Are they strong or weak, fast or slow, foolish or intelligent? Or more simply, what degree of competence do they have? And in the original game of Survivor, these were the most crucial decisions that humans made every day. They not only determined the outcome of interactions with strangers, but also their ability to form trust and relationships with others in their own family or tribe. And after all, if they got kicked out of the tribe, they didn't get to go to Redemption Island like they do on TV. More likely, they were dead within a few weeks because humans are so dependent on one another for food, clothing, shelter, and protection. Social psychologists around the world have determined that all humans everywhere use this universal subconscious thought process in all of our interactions with one another. They found that these two basic categories of perception, called warmth and competence, are responsible for over 80% of all human behavior. For instance, if you think about someone you know who's very warm, friendly, honest, and trustworthy, but is also really competent, capable, and skilled at what they do, this generally causes us to feel admiration and pride. We're attracted to these people and become loyal to them. However, if we flip that around and think of someone who has all the same skill and ability, but is kind of cold and unapproachable, and we're not sure what their intentions are toward us, well, this causes us to feel envy and jealousy. And the behavior that comes from that is distrust and begrudging cooperation. On the other side, if someone is really warm and friendly and trustworthy, but really not very competent or capable, this causes us to feel sympathy and pity, and the behavior that comes from that is kind of indifference and neglect. They can't really help us, they can't really hurt us, and so we ignore them. But of course, the worst combination of all is if someone is cold and incompetent, this makes us feel angry. We feel contempt and disgust, and we reject and avoid them. And so whether we realize it or not, every day we are all passing through these patterns of warmth and competence perceptions that's guiding our behavior. And despite that we've been taught that so much of our success in life is driven by our competence, the reality is that warmth is actually the dominant drive of our behavior because it was more predictive of human survival and evolution. We can't get by without competence, but competence alone isn't enough because it fosters grudging cooperation and distrust. Warmth is where our positive emotions come from. And that's why Rosario's compassion and encouragement inspired Jason to beat COVID and triggered our emotions as well. Just watching them see these demonstrations of warmth and competence causes us to feel these same emotions, even if it's secondhand. And it turns out that it's not just individual people that we perceive this way. Social psychologists conducting research around the world have also found that these warmth and competence perceptions also help explain group stereotypes and cultural biases that exist in many cultures. For instance, elderly people or handicapped people in many cultures around the world are stereotypically perceived to be very well-intentioned, but less competent, which leads to feelings of sympathy, but also to neglect. In contrast, wealthy people are often viewed to be competent and capable, but less honest and trustworthy, and that leads to envy and distrust. Middle-class professionals are viewed to be warm and competent or admired, and homeless and drug-addicted people are often viewed with contempt stereotypically. So when I first stumbled across this work in 2009, it occurred to me that if so much of our social behavior was driven by these perceptions, it's also very likely that these perceptions influence other behavior, like what we buy, where we choose to work, and what we become loyal to. And so I was inspired to contact the world's leading authority on warmth and competence, Dr. Susan Fiske at Princeton University. She was intrigued by my theory, and so we began conducting research on how customers and employees perceive brands and their employers on the basis of warmth and competence. And as we suspected, we found that warmth and competence perceptions were highly predictive of purchase intent, loyalty, and job tenure across many companies and brands, with households brands like Coca-Cola, Johnson & Johnson, and Hershey being admired, oil companies and tobacco companies and banks and insurance companies being viewed with contempt and rejection, luxury brands like Rolex, Mercedes, and Rolls-Royce perceived with envy and distrust. And it's important at this point to point out that these are the perceptions of the total US adult population. Someone who is an owner of a Rolex or a Mercedes may not perceive it that way, but for most people it is beyond their reach and as a result less approachable. And then we also found that lots of government entities like Veterans Administration's hospitals and post offices and the Amtrak are perceived to be well-intentioned but not as competent, and therefore need those public subsidies or may not continue to exist. So all of this in the business world was considered to be fairly groundbreaking discovery, and our work was first published in the Journal of Consumer Psychology in 2012. Since then, our original paper has been cited, validated, and extended in over 600 peer-reviewed academic publications. In addition, we published an award-winning book entitled The Human Brand, which includes dozens of case studies and examples of warmth and competence in action. And the book is not really about branding. Rather, the core message of our book is that actually people were the first brands and faces were the first logos. So all the brand and trade and commerce we've engaged in for the past several thousand years is just an adaptation of how that we were wired by evolution to perceive, interact, and form relationships with one another. Unfortunately, a lot of what's taught and trained in business is fundamentally at odds with what it takes for people to trust one another. And as a result, customer relationships are more transactional and less loyal than ever before. As a result of all this, my academic colleagues and I were recently asked by Consumer Psychology Review to write a compendium paper summarizing the most significant discoveries made over the past 10 years building on our work. That summary paper was published last year, and so this has all been very significant in the impact it's having on the business world. And so if I were to summarize just briefly, in its simplest form, what we now call the human brand insights model can be summarized with this simple illustration. That these warmth and competence perceptions trigger predictive emotions. Those emotions are what result in our loyalty, and that loyalty is what results in our behavior. And over the past decade, our firm has had the opportunity to hone, validate, and apply this insights model commercially on over 160 companies and brands in 8 countries and 6 languages. You may actually be familiar with one of these companies in particular. It's a little restaurant chain called Chick-fil-A. During 2022, Chick-fil-A was rated America's favorite restaurant brand for the 8th consecutive year. They've had double-digit revenue growth every year for the past decade and have a legendary reputation for service and customer experience. Interestingly, Chick-fil-A's brand mission is to become the world's most caring company and to inspire people to take good care of one another. This is John Bridges, the Chief Marketing Officer of Chick-fil-A, speaking to franchisees at their annual Care Next convention in 2019. He spent about 30 minutes talking with them about warmth, competence, and the human brand. In particular, he explained that warmth and competence are literally the definition of caring at Chick-fil-A. Delivering on those basic human perceptions is what Chick-fil-A is all about. And to ensure consistency and progress, they gather feedback to diagnose how well they are caring for customers, as shown here. This is how Chick-fil-A delivers legendary experiences and unmatched customer loyalty. And so you might be wondering at this point, what has all of this got to do with healthcare? Well, in 2019, we were contacted by a large regional health system who'd heard about our work in this area. And they began working with them to apply these insights to patient experiences and staff engagement. Now to tell you more about what happened next, I'd like to introduce Ken Kozelski, the client who hired us to bring the human brand to healthcare.
Thanks, Chris. About 5 years ago, I was recruited to Orlando Health. That's a $5 billion healthcare system in Central Florida. My job was to start a brand new customer experience function for our healthcare system. And at the most fundamental level, to bring it to life, we knew we had to do 3 things. We had to motivate our team to think differently, to act differently, and then we had to measure our success differently. Those concepts and the framework of warmth and competence implies the idea of relationships among all of our constituents. And we want those relationships to be purposefully designed, to be mindful of achieving, when in some instances, are very different goals around the table. Let's start in the patient room. We conducted hundreds of interviews with patients to understand what was most important to them. Through that research, some very clear patterns emerged. Here's what we heard. Patients told us that they came to Orlando Health with more than physical needs. They came with social and emotional needs as well. They have fear that needs to be addressed. And there's some important ingredients in our relationship that must be there if we're going to be successful at reducing that fear and meeting those needs. I'm sure you'll be shocked to learn they just simply are not measured on surveys like HCAHPS. Enter Fidelum. They conducted ongoing inpatient tracking for us in which both HCAHPS, together with warmth and competence, were measured on the same instrument. Also on that instrument was another measure to track trust and loyalty. That's what we used as the dependent variable for this analysis, the outcome we wanted to achieve. So now that we're nearly 3 years in, with over 1 million survey responses, we're looking here at the percent of variance explained between attributes of their relationship that explain the dependent variable of trust. And as we expect, this is what you see on the chart. Warmth and competence blew HCAHPS out of the water in its power as a lever to drive trust and loyalty. I love that we found a way to more accurately achieve and measure loyalty and trust. I know it's what patients care about, but we have to think about our chief quality and chief operating officers too. Is that what's most important on their list? Well, let's take a walk down the hall to their office. They are, for very good reason, very focused on regulatory and credentialing metrics. HCAHPS, CMS star ratings, Leapfrog, Magnet, and all of those things rely on HCAHPS scores. How do those important metrics track with warmth and competence? Here's the good news, and this is what you see here. The data proves that warmth and competence is not a distraction. It's actually a better upstream predictor of HCAHPS domain performance. And this makes sense. Patients care less about a rote, check off the box nurse behavior. They care more that the nurse rounded on them for the right reasons, giving that patient their full attention, listening to them, caring about them as a person, and empathizing and connecting with them on a human level. That should make you and me feel good as healthcare experience leaders. It's nice to know we don't have to choose between hitting a score and making the experience better for patients. You pursue warmth and competence, and you get HCAHPS thrown in as a package deal. Okay, that's the COO and the CQO. We've got another important person to visit in our C-suite. Let's take a walk to the CFO's office now. In addition to proving better HCAHPS scores, we gave Fidelum access to our revenue management data, and they linked it to our survey data at a customer level. We wanted to see if there was a connection between warmth and competence and customer lifetime value. What we found was truly staggering, and here it is right here. For each 1-point improvement in warmth and competence, we saw a per patient revenue increase. It's an incremental $4,400 and an incremental 4.6 encounters. It was a relief to watch our revenue management leaders light up when they saw this data. And here's something that's interesting. We thought it was all attributable to the repeat business, but we learned something unanticipated. Patients who trust us more are also more likely to pay their bills and less likely to default. And here's another bonus finding. Warmth-based loyalty didn't just indiscriminately drive more visits across all points of care. It shifted participation into those points of care that we want and that are better for patients. Here you can see it even drove down ED visits. Okay, we've got one more office to visit. Let's head down the hall to the Chief HR Officer. What are they concerned with today? Staffing. Perhaps they're thinking our staff has never been so strapped. And with that in mind, how could we expect to introduce anything incremental like a new warmth and competence model? There's just no bandwidth to do anything new. Well, let's connect some dots for them. Warmth and competence isn't just for patients, it's a human concept. It's for all humans. It helps describe the key drivers for team member tenure as well. Here you can see that both warmth and competence variables impact caregiver stated loyalty, which has a direct impact on retention. Specifically, each 1 point improvement in loyalty translates into 1.3 incremental years of tenure. This makes sense, and we see it in how we engage with our team members. Here's the takeaway. Warmth and competence understanding of our patients and team members as humans is upstream from all the things our leaders care about. HCAHPS, staff turnover, loyalty, business growth, even financial outcomes. Thank you, Chris, for the opportunity to share our healthcare system side of the warmth and competence story.
Thanks very much, Ken. And so, whether we realize it or not, whether we like it or not, every day we're being judged by both patients and caregivers on whether the experiences we deliver reflect warmth and competence. And despite the remarkable gift we've all been given to accurately perceive the intentions and abilities of others, we've been equally cursed with blinders, often preventing us from seeing how our own words and actions come across to others. And as a result, we inadvertently do and say things that rub people the wrong way, often without even realizing it. And in the process, we damage their trust in us and their willingness to collaborate. In the context of healthcare, we often create inadvertently systems, processes, and practices that convince patients and caregivers that we don't really care very much about what's important to them or how they feel. And in the process, we make the delivery of care much harder than it needs to be for everyone. But we've reached a breaking point. Caregivers and clinicians are telling us they just can't do things this way anymore. They'd rather leave the healthcare profession entirely and try to do what they perceive to be like pushing huge blocks of granite up the hill. Specifically, we've got to remove non-clinical administrative tasks from the shoulders of frontline caregivers and give them the time they need to connect emotionally with each patient. This not only leads to better patient outcomes, but also provides the emotional fuel caregivers need to persevere and avoid burnout. The story of Jason Denny and Rosaura Contreras shows us that it doesn't need to be complicated. It wasn't the 10 dimensions of HCAHPS that inspired her to connect with Jason emotionally. Rather, it was the basic human instinct to connect with others through warmth and competence that she was born with. It's a much simpler compass for caregivers to be guided by, and it's the key to making a lasting difference in the lives of patients. So if you're serious about elevating both frontline caregiver engagement and patient experiences, I can boil this all down for you into just 3 simple but powerful imperatives. First, healthcare organizations need to become more self-aware of how their policies, practices, and processes are coming across to patients and caregivers from a warmth and competence perspective. These perceptions are a subconscious human process, so it's not possible to elicit feedback on them without asking about them directly. CAHPS and other traditional survey questions are not currently addressing them. Second, it's going to take significant changes in our approach to delivering the non-clinical aspects of care. Our current methods and patient ratios are not sustainable, and they're driving caregivers and patients away from health systems in record numbers. And third, healthcare organizations need to take a long, hard look at their goals and priorities and fundamentally rebalance them to focus more on building lasting relationships with caregivers and patients rather than revenue growth, system expansion, or industry recognition. The reality is that growth and expansion are not aspirations that inspire much engagement or loyalty from caregivers or patients, especially when it happens at their expense. So hopefully, the moral of our stories is now clear. In an environment where the need for change is greater than ever before, we don't have the luxury of waiting any longer to adopt a new approach. So I challenge you, don't let your patient experience initiatives lose operational priority or budget support during this challenging period for healthcare providers. Leverage these insights and evidence-based business cases to secure the support of your C-level executives and adopt new care delivery approaches. And if you do, not only will your organization deliver outstanding patient experiences, rejuvenate frontline caregivers, and improve financial outcomes, but more importantly, you'll have the opportunity to make a lasting difference in the lives of countless patients, caregivers, and the communities in which you operate. And there's no greater accomplishment than that. I hope this is helpful. Thank you for joining us today. If you'd like a copy of today's slides and other related background materials, just scan this blue QR code with your mobile device, and they can be sent to your inbox now. Also, if you'd like to learn more about how to apply these insights in your organization, just scan this black QR code to schedule some time to talk with us. We'll be glad to have a more in-depth and personalized discussion with you.